Good Monday morning, everyone. It is February 21st. Welcome into the Morning Medical Update. Thank you so much for joining us here on Facebook, on Twitter, and on YouTube. Coming up today, those who suffer long-term effects from COVID-19, they often wonder, why me and not others who caught the exact same virus? A new trial at KU Med will soon be underway, or actually it is underway, and through the research that they are doing, they hope to answer that question. Dr. Mario Castro, Vice Chair of Clinical and Translational Research at KU Med, and also a pulmonologist here at the health system. He is here to share more details about this trial and this study and how you can participate. Plus, what impact does long haul symptoms have on one main central nerve? We're going to take a look at some of those new findings. And one woman still feeling the effects of COVID joins us this morning live with her unique symptoms and how she's doing today and why this new trial could mean so much for people like her. In headlines this morning, health officials are now focusing on the pandemic's next set of challenges, including preparing for both the health and economic impacts of long-haul COVID-19 patients. A new report from the Mayo Clinic says about 7.5 million Americans are experiencing long-haul COVID-19, with about 2 million people unable to return to work. A big find out there for all you Wordle fans. It appears the popular internet word game can help long-haul COVID survivors deal with brain fog. Researchers at Vanderbilt say the addiction to the daily puzzle, which gives people 6 guesses to figure out the 5-letter mystery word, helps in day-to-day activities to improve brain health. It's also kind of a healthy distraction from doing the doom scrolling that all of us kind of get sucked into on our phones. So make sure to get your questions sent in to us today. You can do that on YouTube, Facebook, and of course, email those to the Medical News Network. You can find links right there on your screen. All right, let's get to our COVID count this morning. And Dr. Dana Hawkinson, do you do Wordle? Have you ever tried this Wordle?
My kids do. I have not tried it.
I bet that is a good thing for kids. Keep them at least off the stupid websites or the sites that they go on. So, did you have a nice weekend?
Yeah, it was good.
Good. Nice to see you. All right, let's get to our COVID count. What can you tell us?
Yeah, so far, as we know, nationally, the cases have been going down. The hospitalizations have been decreasing as well. Same thing here for the health system. You know, luckily, we saw a large decrease in our amount of active infections over the weekend. Again, some of those due to discharges. A few of the deaths, I don't have the full number of deaths at this point in time. Let's see, we did have our last death was in the last 24 hours as well. We've had 36 total deaths for February. As far as active infections, we have 40 active infections. I think most of last week we were in that mid-50s. 4 in the ICU, 2 on the ventilator, still 73 in that recovery period. But overall, I think this is good news. We are seeing that trend, and we are seeing that lagging trend that we know and expect of hospitalizations lagging behind the case count. So,
all right, thanks for that update, Doc. Hot. All right, let's turn. We got Dr. Castro in here with me, and we got Dr. Stites down there in Studio B. Good morning to you. How are you?
Good, thank you.
Good. Did you have some nice time off?
I did. No, I got to be outside. You know, every time I'm outside, I'm happy.
You are. You look nice and refreshed. I want to give you a chance to talk a little bit. I know you've got to jump out to a meeting and then you're going to jump back on with us. I know you're busy this morning, but I do want to just ask if you can comment on this BA2 variant. There seems to be a lot of questions coming in about that, some concerns, and a lot still to learn. But what can you tell us right now?
Yeah, you bet. And Hawkeye will jump right in here with me. You know, BA2, first of all, there's just going to be one variant after another. So I think we have to just come to that basic understanding. And we've seen that, right? There's the original strain, the Alpha variant, the Delta variant, Omicron, and don't forget Lambda and Mu and all those others that were out there. So lots of variants. And the BA2 one appears to be a little bit more transmissible. There's questions about whether or not it does make you more ill. You may have a higher rate of hospitalization and death. We don't know that yet. Initially, reports looked like it was pretty similar to Omicron, but there's been some recent research being published that suggests that maybe it is a little different. And I think the truth is that we just don't know. There's also some concerns about whether or not it responds to sotrovimab or other monoclonal antibody therapy. Initially, and the companies have said that yes, we've tested it, it does look good. There's some other data saying that we don't. So I think we're back to what happens in this, especially here in the United States, when we don't do a lot of genomic analysis, we don't do a lot of genotyping. prototyping and some of that public health infrastructure really isn't as strong as it should be, that we're left trying to grasp at the information before we really have it. So we almost want to know what the answer is. It's like we want to cheat the test. Give me the cheat code. Tell me what the answer is so I can be either panicked about it or I can be okay with it. But the truth is, it takes a while for all of that to develop. And so I'd say right now, around the Stealth or BA2 variant, we know more than we did 2 weeks ago, but we're going to know more in another 2 weeks, which if that sounds hauntingly familiar to you, it's because it's something we've been saying on this program since its inception, which has been almost 2 years, just to point out, Jess. And also that's kind of how science works. It takes time to learn the story behind this new variant. And Hawkeye, I think there's still a lot of story yet to be told.
Yeah, I would agree. I think, always what we have seen is really the initial information, and some of this early information about BA2 is from some clinical, again, observational looks, observational studies. Other is some basic science research, doing these experiments in the lab and taking a look at it. It is very early. I think we need to just wait for the bulk of the information and take it all as it comes in, weighting that important information versus other things. It is still very early. My overall hypothesis, and I think this is borne true since the initial Wuhan isolate, is that there is a large umbrella or that spectrum of disease and severity. And I really don't believe, and certainly we have seen this, that throughout the pandemic, these variants really cause similar amounts. Now, maybe Delta, you had a higher preponderance or maybe a higher chance of going to the hospital. But really, all of what we have seen from the variants so far is that the severity or preponderance has been the same. Now, the other thing you have to remember is that now we humans, individually and as a population, have finally seen this virus. And so we are developing that immune response. So all these studies moving forward, you have to take into the account of the immune response. And again, hopefully, most likely, people will be doing it in that safe way of mounting that immune response, and that is by getting vaccinated. So that is going to play into all of these individual and population studies as well.
Do we have any reporter questions on the line? I do not think we... Hi, good morning.
Hi, sorry, just got a couple. Hey, this is Lindsay from KSHB. We had a couple questions for Dr. Castro regarding the long haul trial. The first is, what's the demographic makeup for the local participants when it comes to gender and age?
So we are studying in the RECOVER study. We are studying adults 18 and above. And so far we have about 20 individuals enrolled into the study, spread across the demographics in terms of equal female and males involved. And we also have a push to enroll, again, underrepresented minorities, to enroll individuals from rural areas. And so one of the unique things we can contribute here at KU is we have access to our patients in the rural areas, and we're really looking for that participation so we can understand how this impacts our patients from all those demographics.
Thank you. The other couple questions. What's the infection timeline? Are these patients who are infected before vaccines were available, after, both?
Correct, both. We're looking for anybody that has had COVID within the last 2 years. And so this does need to be demonstrated on a test, or if it was before testing was available, do have to have certain criteria to meet probable COVID cases. We are very interested in understanding what happens in the acute infection, why some patients go on to develop these crazy long COVID symptoms, and why others don't. And so we need both patients that have active infections as well as those that are recovering from their infection.
Is there a focus on vaccinated or unvaccinated? Are you looking for, and have you seen both or one or the other primarily?
Yes. Fortunately, we've enrolled, the majority of our participants have been vaccinated, some with or without the booster. And I would say that we want to see we want to see those that are vaccinated and unvaccinated enrolled, because then we can really learn a little bit more about what the impact of that vaccine is in comparison to things like natural infection. There are a lot of important questions we need to address out there.
That's it for me. Thank you so much.
Thanks, Lindsay. Any other questions on the line? All right, I think we're good. All right, Dr. Stites, I'm going to ask Dr. Castro a couple quick questions, and then you can jump in as well. Dr. Castro, Lindsay brought it up, the trial. Tell us a little bit about what this will entail. Give us some more details that you haven't already shared.
Sure. The trial is called Recover, and it's in regards to enrolling patients that have had long-haul COVID symptoms so that we understand better what are those syndromes that we're seeing, you know, the effect on the brain fog, the cardiovascular effects on the heart and the blood vessels in the lungs, the patients that have shortness of breath, and patients that have that profound fatigue that is leading to disability from this long COVID syndrome. So we're really looking at the whole spectrum of disease from, again, acute infection all the way to patients that have had COVID, say, a year ago. Certainly we want to enroll patients that have been within the last 2 years that have had that COVID. We are enrolling nationwide into this trial, 17,600 patients. The vast majority are those that have had that acute infection. We are enrolling some healthy controls, so people that have not had anything, including not having had COVID. We will test for the antibodies to see if you've been exposed, if you're enrolled as a healthy individual, whether or not you have mounted antibodies or not, to test that theory as well. And our hope here at KU is to enroll near 200 participants here to contribute to that nationwide story of what we're trying to learn with the Recover trial.
And there is a QR code on your screen right there. You could just hover your phone right over it with your camera and it will pop up, and that's how you enroll. It's that easy, right, Dr. Castro?
That's right. You can either use the QR code and contact our coordinators, or you can email us at covid-research-team@kumc.edu.
What else do people need to know about who would make a good candidate for this or who wouldn't? I mean, there's so many people who are suffering all types of long haul symptoms. Some people thinking it's all relative to how your body feels, Dr. Castro. So is there anybody who would make a really good candidate and somebody who just might not be right for this trial?
Well, we're purposely, and as Hawkeye mentioned, that spectrum of severity. Mm-hmm. We have boundaries in terms of how many we can enroll that are from the hospital, because that is one end of the spectrum. But we also want to understand there are some patients I've heard, that have had mild acute infection, but then develop those long hauler syndrome symptoms. So we need to understand both ends of that spectrum and why some patients are developing long haulers or not. So the ideal patient really is anybody that is willing to give a little bit of their time to participate in the study. There are, as you can imagine, anything like this, that there are going to be a fair amount of questionnaires that we're going to give you that you can perform online. So a lot of these can be performed in the home setting after you've given consent. And then there is some blood work that we're going to be asking for to come on site to contribute that blood work. And then depending on your symptoms will then trigger what kind of testing would be indicated for you. So, for example, if you have symptoms of shortness of breath, we're going to be doing pulmonary function test or lung function test. We're going to be doing a CAT scan of the chest to take a look at the involvement in the lungs. If you have brain fog, you're going to get a whole nother series of tests that will be related to what's happening in terms of your cognition, your ability to perform tests, and then what some patients will also trigger a brain MRI for us to study the brain. So what we do know is that all the testing that we do as part of the trial will be covered 100%. There are no cost to the participant. And so this is very important. We all have to often pay copays and all these other things that sometimes influence our decision making about participating in testing. The nice thing about this, together with the KU Health System, we have made a negotiation as part of the study that all cost will be covered as part of the testing.
I'm glad you said that, though. I think a lot of people, that's an initial question for many people. Yep. The last thing someone needs after they've possibly been out of work or had COVID is to have any sort of expense to try and help out other people. So how important are these participants to your work, Dr. Castro?
Well, as Dr. Stites alluded to, we are still early. Even though we're 2 years in this, we are early in the understanding of what happens afterwards. What happens after you've had that acute COVID infection, and what's clear is that this is our public health crisis over the next decade, likely. We are anticipating that 20 to 30% of participants, and some of those numbers that you gave at the opening really confirm that somewhere 20-30% of individuals are going to experience these symptoms. And what we've seen in our clinic here at KU, as well as others across the country, is that it can be quite disabling. So patients aren't returning to work because they just can't function. It's either physical can't function or sometimes mental can't function as well. So we need to understand more what is exactly the cause of those symptoms, what's driving that, and then potentially we could come up with treatments that would be specific to those causes that are leading to the long hauler syndrome.
So a recent article published in the New York Times shows how long haul COVID exists in the body. This is what Dr. Castro was talking about. In the brain, it causes inflammation, cognitive issues, in the lungs, low oxygen levels, in the circulatory system, damage to blood vessels and blood clots that may trigger fatigue, in the immune system, and autoantibodies may set off a chain reaction. So just a host of symptoms that people are dealing with. A short time ago, we had mentioned that more than 2 million people could be on disability because of COVID long haul. So you mentioned that people having to quit their jobs. And one of those people is joining us this morning. Stephanie, good morning to you. You had COVID, you have long haul. We're going to talk all about that, but ultimately you had to quit your job. Tell us when you thought you had COVID, because I think you said you had COVID before testing was widely available. Tell us how you knew you had it.
Right. So it was almost immediate. You had this really eerie shortness of breath, headache that probably was tenfold to what you had had before. So as soon as I started to feel those symptoms, then I knew I was going down that path.
Based on what you had already heard about people having COVID, you knew it. And I think that's it, Dr. Castro. A lot of people say it's just so different than anything they felt before. Is that fair to say with so many people that, especially early on in the pandemic when they weren't able to get tested?
Yeah, no, definitely. I think this is one of our challenges is that, early in the pandemic, we didn't have the testing, but now we have it. And I think we, as a public health, really want to encourage testing as often and as possible, because this is really one of our tools that we can use now to establish what's going on. Because, some of those symptoms can be caused by the flu. We're still in the midst of the flu season, and so you want to make sure what is going on is COVID infection.
Is related, yeah. So Stephanie, you have COVID, you get over this, and now you've got, you list any symptom, and I think you've had it when we were speaking earlier. Tell us a little bit about that. Tell us what you have experienced and leave nothing out.
So I started showing symptoms in July of 2020, and I ended up going
long haul symptoms, not COVID symptoms, correct?
So COVID in July and August, and then long haul symptoms in September.
Got it.
And I went on short-term disability. I had the gamut of symptoms, brain fog, had difficulty on the cognitive side, either formulating sentences or spelling, completing thoughts. If I went to drive somewhere, I would get disoriented very quickly, couldn't quite remember where I was. I was having all sorts of deep anxiety. Not only just like physical anxiety, but also anxiety of questioning what was going on in my body. Because when you do have the flu, or you do have, say, another virus, you almost always return back to center. And during this fall of 2020, it was as if COVID was never ending. And so you start to kind of get concerned because your heart is palpitating, you're having shortness of breath, you're dizzy, you're incredibly fatigued, you've got muscle pain and other things that were with you when you had COVID, but then they still keep kind of periodically showing up post-COVID.
You talked about the anxiety. You also mentioned OCD. You mentioned that to me. Tell me about that. And then Dr. Castro, I want to talk about some unusual symptoms that you're hearing from long haulers. What was the OCD like?
So I more likely than not always had OCD, but it never represented itself or showed itself in the form that it was showing post-COVID. And I had originally reached out to a therapist for cognitive behavioral therapy, not only just for therapy for the anxiety what I was feeling, but also for the insomnia. Because during COVID and post-COVID, I had quite a bit of insomnia and it was difficult to kind of deal with. So as I was going through that testing, it was becoming more and more obvious that my anxiety was probably more centered around OCD, which is an anxiety disorder. And like I said, I probably always had it, but it was in a manageable state. And then it started representing itself in my day-to-day life in a way that I had never experienced before. And so I ended up going to see an OCD specialist who had said that they were seeing an increase or uptick in patients because of COVID.
Dr. Castro, have you pretty much heard it all? I mean, are you surprised by that or not surprised that someone would have some unusual symptoms show up?
No, I think, Stephanie, I definitely empathize with your case. I've heard this from so many of my patients that, similar symptoms that you describe. And how frustrating that is. You think you get through this COVID and then you have to deal with all those aftermath effects. So it's, patients like you that we need to participate in the RECOVER trial because we're trying to find out what that root cause is. And some of those symptoms that you mentioned in terms of the brain fog, the anxiety, we think it's likely related to effects of the virus itself on the immune system. And how does that virus trigger the immune system? Well, it's clear that we've seen this in other viral infections where a virus can attack the body and then there is this aftermath effect because our immune system is now revved up and it's reacting sometimes to itself. It can react to the nerves that lead to smell and taste, as we've heard about in patients with COVID. But it can also attack the brain. And we also know that there can be little microclots that form because this virus, for some reason, attacks the lining of the blood vessel, and it can form these microclots. So what we're trying to understand is what's causing conditions in patients like Stephanie. If we can do diagnostic tests, to figure out, okay, is this more related to the small clots or is this more related to Stephanie's immune system, then we can channel our treatment towards that particular cause. And so, as Dr. Stites mentioned at the very beginning, we're driving the ship and we're learning as we go. But what's clear is that we need better targeted treatment to help patients like Stephanie to do this. And I do think one thing we haven't talked about is the vaccine, and that it is so important. Recent study that just came out this past week suggests that if you had the vaccine, that your chances of developing long COVID symptoms afterwards are about cut in half compared to the unvaccinated. And then if you had COVID and you get vaccinated, it also helps decrease the risk of symptoms related to long COVID. So we now know that, because there's always this false news that's out there sometimes that the vaccine might be related to some of these symptoms. We now know that's not true, that there doesn't appear to be any worsening of symptoms in patients that got vaccinated that develop long COVID symptoms, but that there's actually a protective effect from developing those symptoms.
Stephanie, how are you feeling today?
So today, life is good, but it's definitely been a journey. And I would definitely second the comment on the vaccines in that every time I received my vaccine or booster, I felt better. So it was important for me, as soon as the door was open to get the vaccine, I wanted to be one of the first because I wanted that improvement in my symptoms.
So, Dr. Castro, would someone like Stephanie be a good candidate even though some of her symptoms have gone away? What can we learn from somebody who's had them, who's an official long hauler, but no longer having? I know, Stephanie, you're still having some lingering issues, but what are your thoughts on that? What kind of candidate would she make?
Yeah, no, we're interested in patients like Stephanie because we have to understand, why does somebody like Stephanie start to recover and why others don't? And so that recovery process, what is it about your immune system that's different? What is it about the effect that this virus had on your lungs or on your brain that allowed you to recover to the point that Stephanie has? And so we believe that the tests that we're doing, in fact, some testing that specialized imaging that we're doing here at KU Medical Center, allows us to sort this out. We have a test where we're looking at the uptake of a molecule inside the lungs called xenon. So this is an MRI scan that we do of the lungs, led by Dr. Peter Nabalski here at the KU Medical Center. And in this program, what we found was, interestingly, was that all the CAT scan, all the breathing tests were normal, but these patients actually could not normally take up the xenon into their red blood cells, indicating the same thing would happen with oxygen. You're not able to take that up. And we believe it's because the virus has done some damage to that capillary that leads to the oxygen being uptaked into your body. And so this is exciting because now we have a test that potentially can detect this in those very early stages, even when you're having minor symptoms, that when we look at your CAT scan, we don't see gross changes on the CAT scan. We may see some minor changes, and we're not sure is that related to COVID or not. But this additional testing that's available through the Recover trial will help us sort that out. And studies are always in the power of numbers, right? So when you're talking about 20 patients here, well, that's important, but 17,000 patients across the country, that's what really is going to drive the answers.
So I can't help but think how much help this study is going to help validate people like Stephanie, because I know that she had mentioned how she's been, people have doubted her, and she's had to answer a lot more questions than she's ever probably wanted to when she's going through something like this. I know you had to quit your job because they weren't convinced that you even had COVID, let alone are now having COVID long haul symptoms. You had to move back in with your family. What has that been like? Just the social aspect of it on top of the health issues.
Yeah, I mean, it's really humbling. And I think that's why it's important to have these studies, because there's a lot of taboo topics that are being covered. For me specifically, the OCD, that usually with mental health brings on some kind of judgment or some kind of opinion or stigma. Then there's also, my hormones were greatly impacted. So then there's discussion about perimenopause or menopause. My GI tract is disrupted. So those are unpleasant conversations. So it kind of uproots this conversation with people. And unless they're actually going through it, it's really hard for them to understand why all these different symptoms would be something that you would be expressing. And because I was early enough on in the process or in the pandemic, there was a lot of hesitancy on behalf of my employer because I never tested positive. And, I wasn't hospitalized. So therefore, why would this person want to go on short-term disability, or why would this person need to move in with their parents during this stage in their life? Because it doesn't make any sense. And I get it. It logically doesn't make any sense. And especially early on, it really didn't make sense. So I think that's kind of part of the bewilderment. And because these topics are so taboo, a lot of people don't want to bring them up and admit that they're actually feeling them or going through them.
We're going to get to some community questions, but Dr. Castro, I mean, it's so new still, 2 years in. It's such a mystery. And you're right. It's hard for people to get out of their head the image of somebody on a ventilator versus somebody who gets COVID and is just having these long, miserable, lingering symptoms. What are your thoughts on that? And what's your message to the community about understanding what these folks are going through?
Yeah, I again empathize with Stephanie because definitely I've heard this story from many patients where, they go to their doctor and they don't get answers sometimes because, the doctor doesn't know for sure what to do in terms of testing. So this is where the power of a study like RECOVER allows us to do a battery of tests specific to the symptoms that a participant is having and allow us to get to some answers. At the end of the day, when Stephanie is going through that difficulty as she describes in terms of, well, I wasn't in the hospital, I didn't have it that severe. We need to understand, is there objective testing that allows us to say, yes, this is related to the virus? And sometimes that's going to be a battery of standardized questionnaire testing that helps us kind of differentiate that. Sometimes it's imaging, sometimes it's blood work, but it's going to be the combination of these things that allow us as physicians to really understand how much of this is related to the virus and how much is related to underlying problems. Our patients, have diabetes, have
They
obesity.
had problems before COVID.
Yeah, before COVID. And so, sorting this out is not easy, and understanding how much of this is related to that underlying comorbidity, underlying illness. And so we hope that at the end of the day with RECOVER, we are going to understand if you present to your doctor with symptoms of fatigue, this is the appropriate testing for you. If you present with shortness of breath, this is the appropriate testing for you. And that will then give the tools to doctors like Hawkeye that will help us understand then, based on that testing, what's the appropriate treatment. And so these are really the critical next steps in order for us to get ahead of this, now not just the pandemic, it's the public health impact that this is going to have after the pandemic.
All right, let's get to our community because there's a lot of questions for Dr. Castro. Clive wants to know what treatments are able to help long COVID symptoms like breathlessness.
Yeah, so treatment is the hardest part because we're not quite there yet. We do have some great treatments that we use on the acute infection setting, but we have so little information yet on the long hauler symptoms. There is some suggestion that using therapies that will relieve those causes that we talked about. Could you modulate the immune system early on in the acute infection? Will that have impact on the long symptoms that are occurring? And so that's actually being done. There is an active one. We used immune modulators in the acute infection, and now we're studying those patients over time. Could that, by modulating this immune system, impact those symptoms long term? Could you use something like a blood thinner to try to dissolve those little microclots? Again, we have a study that's looking at that exact question in Active 4. But unless you do this very carefully, and you do it with good science, good rigor behind randomized controlled trials, you will have everybody saying, "Oh, this is the right treatment," and that's a lot of times misleading and can be harmful if you take the wrong thing for you. So we ultimately need help from participants to participate in these trials to figure out what's appropriate treatment, how can we get people like Stephanie better quicker.
All right, Joe Ellen, help her with this one. Dr. Castro, it seems like the number of variables is high. For example, gender, age, vax status, symptoms, disability, rural, city. Why so many? Could you find out more by studying fewer variables?
Well, I wish it was that simple.
It's never, I know, but try to break it down so we all could understand that.
Yeah, it's likely not going to be related to just a few variables, and it's recognizing, when we recognize new patterns of a disease, we understand who's at risk to it, who's at risk for, say, brain fog, and then we understand who's at risk for the heart manifestations from COVID long hauler symptoms. We understand what those risk factors are, and then we can do diagnostic tests. So if you go in with an increased risk, well, it's more likely that your testing is going to be positive. So I suspect at the end of the day that it's not going to be simple in just a few variables. It's going to be taking all that into consideration. Sometimes we may have to use the power of computer and artificial intelligence to understand that, and we're certainly doing with that with the imaging studies that we're doing here at KU. We're using our supercomputers to basically understand all those different variables and to put them together. But as I mentioned earlier, it's all in the power of numbers. So having 17,000 patients allow us to understand what each of those variables are contributing to long haulers.
Dr. Stites, welcome back to the show. How are you? You're on mute.
Uh-huh.
There you go. They unmuted
Yep.
you. How are
All right.
you?
Thank
Okay,
you.
you're
I'm
back.
good.
All right, so we're talking with Dr. Castro about the new study, and Stephanie is on the line. She's one of our long haulers, and so we're just getting to some community questions right now. So Isaac has a question. I remember hearing stories about long haulers seeing their symptoms improve after being vaccinated, and I think we kind of touched on this. Any clues on what's behind that phenomenon?
Well, I think we believe it's related to the immune response that the vaccine elicits. And we know that our body's immune response is very important in terms of resolving symptoms from COVID. We understand, because of the other end of the spectrum, when patients are immunosuppressed, those are my patients, unfortunately, they're in the hospital really sick because their immune system is just not working to contain that infection. So we know a little bit about it in terms of what's causing that, but certainly we have a lot to learn. How do you appropriately guide that immune response so that it protects you and it doesn't do any further harm? And I don't know, Hawkeye, if you have any other thoughts on that question.
No, I think that's the best answer that we have. It hasn't fully been elucidated yet. I think you're right. Is it having to do with some sort of immune function? Is there an immune reset there? Does that help, or help reduce some of that immune response that may be continuing to go on during this? Just as you said and made some good points earlier about the etiology of long haul, we don't fully know. I think it is right to say that there are several possibilities. It's probably multifactorial, just as you said. Is it a continued immune response, some low level of immune response that's causing inflammation? Is it having to do with the blood clots? Is there some autoimmune, some autoantibodies that have been produced? It is likely multifactorial, but I agree with you. I think we have heard those positive stories from people who've gotten vaccinated. Is it due to some sort of immune system reset with that vaccine dose? These questions are being asked, they are being investigated, but I think it's going to take a lot to really fully elucidate some of those answers.
Stephanie, Jennifer wants to know, what was the very worst symptom you had? And also if you experienced depression during all of this.
I definitely didn't experience depression. I think it was more frustration. The anxiety itself, just kind of what's going to happen next, felt pretty bad. But I think overarching, my systems weren't syncing anymore. There were a series of different systems that just were not operating the same. And so you physically, emotionally, cognitively just did not feel well. So it was a culmination of all things. Ultimately, what was the game changer for me was, as I was working through the specialist, I saw an endocrinologist, and they gave me a very small dose of a synthroid, levothyroxine, and that started to put my systems back into sync. And that was a huge game changer. That's where everything started to improve.
Dr. Castro, can you mention more about that medication?
Sure. This is a thyroid replacement medication that Stephanie mentioned. So what we know about the virus is it doesn't attack just one organ. It doesn't attack just your lungs or your brain. It attacks every organ. And in fact, when autopsy studies have been done, you can detect the virus everywhere in all these organs. So likely there was an impact of the virus on her thyroid that caused a deficiency in that, and then resetting that with a hormone, as Stephanie mentioned, would allow her body to function better.
Dr. Stites, jump in here and just help us, in patients like Stephanie. It's been such a mystery, and it's so frustrating for these folks. Just, with the patients you see, what what insight do you have, and what kind of advice would you have?
I think that the challenge is always to, how do I deal with a chronic illness when I've been thinking of myself as being healthy for most of my life, and then how do I adjust, and how do I cope with that, and how do I keep hope alive? Because what I find, at least in my practice, I take care of a lot of people with very significant chronic illnesses, but this is the life they've always known. And so it's got its own set of challenges because of that. But if you've always been healthy and now your life is turned on its head from something that 2 years ago you didn't even know existed because it didn't exist, you're left asking, why me, why now? And then you have to try and figure out what's the right way forward. And what I think the best thing you have to know is that there is always hope, and you hear it with Stephanie's story and people feeling better and recovering and finding things. But I think one of our challenges is that long haul syndrome isn't just one disease. It's really lots of different problems, and long haul can come about from a different etiology, and trying to address those individual etiologies is probably where we're going to make the most progress. And unfortunately, sometimes that just takes time, but I bet we're going to get there, just as we have with other chronic illnesses. This pace of change and the rapidity of scientific development is so much faster today than it was 10 years ago or 20 years ago. And we've hit on that a lot in this program, how remarkable progress is. But still, if you're the one and you never saw it coming and your life is turned on its head, that's a challenge, right? That's a big challenge. And the good news is that it's a challenge we're all going to take on together, and we're going to solve it.
I have a couple more questions while we have Dr. Castro here. And Sharon wants to know, would someone that had a stroke back in December 2019 also had severe COVID, was doing much better with brain fog until the stroke happened, from the stroke until COVID happened, so that helped kick it into gear. Would that person be eligible? Maybe somebody who didn't have it but then gets COVID, it starts up again?
Well, as long as the COVID has been infection been within the last 2 years, which it should be, then she would be eligible. I do think that this is exactly like we were talking about earlier. Patients have pre-existing conditions, and in this case, if somebody had a stroke before, they're at increased risk of developing COVID because of their underlying illness. And so this patient will compare their imaging post-COVID to their imaging before COVID, and this will allow us to understand better what difference did COVID make in that particular individual. And I think that will give us some insight into what the potential causes are. We do see strokes happen from COVID. Unfortunately, in our medical ICU, we've had patients we've taken care of that have had strokes just because of that attack of that virus on the lining of the blood vessels can cause a clot to form, and unfortunately that clot can cause lack of blood supply to a part of the brain and cause a stroke.
Simon has a question, and I'm glad he asked it, because we actually have people asking. When Dr. Castro is back on, we want an update on the ACTIV-2 trial. Any updates on that you can share?
Well, ACTIV-2 is a trial where we're adapting as we go. We've studied now over 6 different treatments for outpatient COVID infection. One of those went on to under EUA to be approved for a monoclonal antibody treatment. But we have several that are in the pipeline right now. We've had to re-engineer the study as we go. As Dr. Stites mentioned, we at one point in ACTIV-2 had a arm that was using the Regeneron mixture of monoclonal antibodies, and in the setting of Omicron, we had to reconfigure that study and change that because it wasn't effective for those patients as a comparative treatment. So I'm excited. We have some candidates that we're studying right now in terms of both inhaled treatments as well as injectable treatments. And so we're trying to understand, at the end of the day, we need better treatments for this as an outpatient. We need to get this in the hands of doctors that can use it in the community, that will allow us to treat this so early in the process that maybe we won't talk about long haulers down the road after we're able to have those tools in place. And, as Stephanie mentioned, you think about, the common cold. We don't think about lingering effects from the common cold. And a lot of that's because, again, we have effective treatments. If something happens as a complication, that we can intervene very effectively. Right now, we need those tools in order to intervene with, to try to prevent our patients from developing long-term symptoms from COVID.
All right, Dr. Stites, we're going to get to some final thoughts. Do you have a question for your friend, Dr. Castro?
I have a lot of questions. My first is, when is he going to shave?
It's not happening.
It's my winter look, Steve.
That looks good. It looks good. Mario, as you look down the road, tell us, what do you think is the next big thing in the treatment of COVID-19? Where do you see us going, and especially both for COVID-19 in general, long haul? Give us your sense. What's your crystal ball tell you?
Well, it's a great question. I think at this point, I think we're eventually going to get to the point that we're going to use combination therapy for acute treatment and acute management. Because we know that in other viral acute infections, often we need to use combination therapy. So we're just starting to get on the crest of studying that. The other nice thing about combination treatment, it helps us combat some of the variants that emerge along the way. I think in terms of the long haulers symptoms, I think we are, as you mentioned, we're going to get to the point that we say, this patient has the particular shortness of breath due to the blood vessel being attacked on the inside. This patient has a different syndrome that's leading to their shortness of breath that's due to the scarring that they have inside the lung. And then we'll be able to change, we'll be able to treat those differently. And so that's how I think we can get in front of this before it really causes the disabling symptoms that our patients are experiencing now, as Stephanie has nicely mentioned. I think ultimately we got to get ahead of that curve. Otherwise, this is really going to have a true financial impact on our society worldwide. It's going to have a really disabling effect on our workforce in the future.
Rebecca has a question. Oh, can I just ask Dr. Castro one quick question?
Please.
For Rebecca, she just wants to know if there's any autoimmune conditions that are more at risk to develop long COVID, and if so, is there anything you could do, Dr. Castro, to reduce the risk?
So autoimmunity is certainly something that we're actively studying. We believe that there are a number of these things that we've been exposed to in the past that may trigger a more robust immune response. And so we're looking at things like prior viral infections, like Epstein-Barr virus infections. How does patients that have had that prior immune response then react to COVID-19 itself? If we can understand that better, perhaps then we could use therapies that will block that immune response, that autoimmune response in certain patients. It is something that is a little bit of, a balancing act, though, because you don't want to suppress the immune system too much, right, because that puts you at risk of other infections. But you do want to suppress that part of the immune system that is leading to the consequences of things like long haulers COVID. So we're not there yet, but we're starting to study that tonight. Hawkeye, I don't know if you have any thoughts in regards to.
No, I think you summed it up very well.
Dr. Stites?
I think this is the classic case of science. The more you know, the more you have to learn. It's called the Moore squared phenomenon. And I think that's where we find ourselves with COVID. And that's the hard part, right? When you build an airplane while you fly it, you want to have all the parts fit the first time, and you want those parts to last forever. The problem is that the rules keep changing. And so suddenly the parts don't fit anymore, and they didn't last forever. We know our vaccines are going to have to change. We know our therapies are going to change. And that's part of how we treat life. But we've done that for years in medicine. The way we used to treat simple infections like Staphylococcus and pneumococcus have had to change because of resistance. The way we've had to treat other diseases, cancer therapy, has changed. And we do all these things together, and we do it, and we spend hours studying each patient to try and figure out what's the right way to approach that. It's almost like each of us is our own N of one. And we all have our own body, on our own historical diseases, our own epidemiologic factors, their own environmental factors, and we have to decide how best to apply this science. And the best way we can do that is by studying it together, and not to try to just use our own personal observations, but to study together so we answer the questions: what really works? What could actually hurt you? And what is stuff you can just put aside and maybe look at for another day? So the more you know, the more you have to learn. It's more squared. It's not a bad thing. It's a good thing. Good challenge to have. Let's go.
Let's do it. Okay, Dr. Castro, I want to get to final thoughts from you, but before we do that, I want to remind folks of the QR code that is on their screen. So if you want to enroll in the trial, you can also email the team there at the email address on your screen, but just hover your camera over that and that'll pop up. You can enroll and find out more information. What else do you want them to know, Dr. Castro, before we go about enrolling?
Well, reach out to us and we'll be happy to answer any questions in regards to your candidacy for the Recover trial. I do want to encourage even folks that are living at a distance in rural communities from us to participate. Often just a few visits here, and then most of it can be done from your home setting. So don't be afraid. At the end of the day, your contribution is going to help us get ahead of this in terms of lawn haulers. And so give a little bit of yourself. Just like Stephanie mentioned, she is recovering from this, but there is a lot to be learned from patients like Stephanie, and I really again encourage folks to scan that QR code or call us, and we will get you into the Recover trial.
We appreciate you being here with us today. Any other final thoughts you want to share? Is that it? Are you good?
I'm good.
Okay. All right. Let's turn to Hawkeye. Good. Let's get some final thoughts from you. Take it from there.
Yeah, I always appreciate Dr. Castro on here. He's done such a good job of heading up these trials here at the health system and the medical center. And I think it's very important. These trials are done all over in all kinds of medicine. This evidence-based medicine, and this is how we get our algorithms and our treatments to provide you with the best, most beneficial, and most safe treatments. And this occurs everything from stroke treatment to heart attack treatment to high blood pressure, everything. Dr. Stites has mentioned it before as well for CF, and we are gaining more and more knowledge through these well-conducted trials. And then when they do go to peer review, they are critiqued to make sure that everything is above board and it is accurate. And so I think we are learning this. Dr. Castro has taken this up here. We've seen a lot of good information come out of these trials, and we'll continue to wait for more information from not only these trials, but other trials that are conducted around the world as they become available.
Stephanie, thank you so much for being with us and sharing your story. Folks on our feed and our viewers just really appreciate you being so open and willing to share your health journey with us. So we appreciate it. Any final thoughts? What do you want us to know as we head out this week?
Well, thank you for having me. And then I think trials like these are going to be so important, not only to make sure that future generations or future COVID sufferers don't have long haul symptoms, but it also creates a sense of community so that those that are suffering or working through different issues have a community that they can be a part of, feel inclusive, and just kind of go through the journey together.
Thank you again. Stay in touch, okay, Stephanie, and be well.
Okay. All right,
Dr. Stites. Dr. Stites, your final thoughts today.
My final thought really revolves around this. Where would we be if we didn't have science to help us? If all we had was personal observation and looking at the world, which is incredibly important, right? I have to try and look at see how I get dressed every day, and sometimes it works, sometimes it doesn't work so well. But at the end of the day, when you're trying to treat people in medicine, you want to do no harm, you want to do the right thing, and you want to save the patient. How do you do that in combination? You do that by trying to take an intense study to make sure that the things you're doing for folks are helping them. And I think long COVID is really like that. We're going to have to try a lot of different things, but we have to try it together so we can make sure that the things we're doing don't hurt people and actually help bring benefit. If we each do it on our own, we won't know the end. We won't know that because we don't treat enough patients to really know that. But when we do it together and we work hard at it, we can learn together and we can help benefit all these folks who are suffering. And ultimately, let's end this suffering because we want to put COVID back in its place.
Well said, Dr. Stites. Thank you so much. All right, and thank you everyone for joining us today. Coming up tomorrow, head trauma is nothing to mess with, as we've seen recently in the news with actor and comedian Bob Saget's unusual death from a head trauma. We're going to discuss that and what to look out for and how deadly is a slip and fall and a bump to the head. Also,
it is a miracle. I mean, I tear up thinking about it. Seeing her from that moment and what we have went through, and it happened so fast.
we'll meet a young girl and her family and how one of our doctors helped save her life after a slow brain bleed, and the special gift that they gave this healing doctor. Plus, a new procedure that will likely become the new standard of care in treating certain types of brain bleeds, and how the health system is just one of few places in the country to be using it right now. We'll talk all about that coming up tomorrow. Everyone, have a great Monday.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.